Welcome, everyone. This is Carly Sage. I am the founder of Sage Health, Functional and Integrative Nutrition, and also the founder of Block 134, an arts and wellness collective in downtown Putnam. And at Block 134, we have the pleasure of welcoming and sharing space with Dr. Irene Catania, who is with us today. And today we're going to be talking about acupuncture, which is just fascinating to me. I'm so excited to dig into this conversation with you, Irene. How are you today?
Thank you. And I just want to thank you again for the opportunity to work at Block 134. And people are happy for the space. And it's great to have the art gallery there. It's just a wonderful, welcoming space. Thank you.
I love hearing that. Yes, love hearing that. Good. It all contributes to health and wellness. So this is part of creating the environment and adding things to just optimize people's health. And acupuncture is the topic today. Um, and you offer acupuncture at Block 134 in the private treatment room. And I know you're a naturopathic doctor and a homeopathic doctor. So tell me a little bit about your training as an acupuncturist and what made you decide to add this modality onto what you studied as well with naturopathic medicine.
Thank you. I first was introduced to acupuncture. I had treatments about 50 years ago. And when I went to naturopathic medical school, it was part of our training, not the needling aspect, but we were required to study the theory of acupuncture. So I had a couple of classes like that. That was fascinating, a little bit difficult to study Eastern and Western medicine simultaneously. Um, Interestingly, here in Connecticut, a medical doctor, a naturopathic physician, it's generally part of their license. They don't need additional training, although some people may do a 300-hour course. Myself, after becoming a naturopathic physician, I decided to go back to school while I was practicing, and I did a 3-year, 3,000-hour course. I
Wow.
compare acupuncture to being one of the most sophisticated systems of medicine compared to Western medicine. And of course, we continue to train to keep up our license. A turning point for me was after I graduated naturopathic medical school. I was in a car accident 2 days later, and I immediately had acupuncture at the school clinic. I had chiropractic, I had physical therapy, and everything helped a little bit. But what I felt was the most significant thing was the acupuncture treatment I received. So I received that over a period of about a year and a half and then went to acupuncture school.
Mm.
And I felt, although naturopathic medicine, we can address just about everything. And that includes our training in functional medicine, but we were limited in our treatment for pain.
Mm.
Um, so this was something I felt I had to add, and it just amazes me the results that we can see with it, sometimes in a short period of time. It depends.
Wow, what a story. Yeah, and that's how it often works with practitioners who go into specialty areas. Like me, I want to experience something myself, and then I feel that
Yes,
inspiration to share that with others as part of my healing approach. So, yeah, that's wonderful.
exactly.
So, can you share with our listeners a little bit about how acupuncture addresses health and disease?
Yeah, so acupuncture, it is considered a complete system of healthcare. And in this country, most people think about it for pain. That's what brings them to acupuncture. But actually, we can address any condition. So in China, a person may choose to go to a conventional doctor or just use acupuncture and Chinese herbs exclusively for their health care.
Hmm.
Acupuncture is similar or on the same level of homeopathy in other types of healing, and that it's an energy system of medicine. And many people they don't know that. So they think when you're putting a needle in someplace, you're putting it on a nerve pathway. And that's what's affecting their pain. But actually, it's based upon the principles of vital force, this energy that has the ability to heal from injury or illness by balancing the energy within the body. So we're looking at within the body, there's energy pathways called meridians, and there's 14 of them on each meridian, and they correlate to organs, but not exactly, because the organ that names the pathway has totally different principles than Western medicine. So when we look at the pathways, there could be at least hundreds of points on those pathways. And the choice of what point to needle depends upon an assessment of what's out of balance. So with pain, we would look at generally the energy is blocked. And when you have blocked energy, which we call chi, then you have pain. And the goal is to get that energy to move. And we may not necessarily needle exactly where the pain is, although we might if it's a low back pain. But an energy pathway can run from the top of the head down to the toes. So you could conceivably needle points on the feet or ankle to address the low back. So it's a very complex
Wow.
system of medicine, but ideally, you're dealing with energy pathways.
Mhm.
Occasionally, with pain, you may needle locally in the area where you may have spasm or the muscles are tight to loosen that muscle. But actually, you could also just needle on the hands, and the same thing can happen. And this concept of energy is also applied to all systems of the body. So if someone had digestive complaints, as I had the other day, we can also do needling for that. If
Mm,
it's a chronic condition, then of course you would need a number of sessions.
mm. Right. So it sounds like you can address both acute, like pain related or injury related situations, and chronic conditions as well. Yeah.
Exactly, exactly.
So what disrupts somebody's chi? And chi is spelled QI. So if anybody's seen that word, it's they may not know how to pronounce it before this. But yeah,
Yes,
how does somebody's chi get imbalanced
it
other
could
than an
be in,
injury?
yes, so it could be imbalanced by stress, which is very common. Most people have some level of stress. Some people, they've had a trauma, a big stress, and that throws them off. And they'll say, I've never been the same since I had the trauma. And the trauma could be a mental, emotional trauma, like a loss or a grief.
Mhm.
It can also be a physical trauma, like surgery. So it could be post-surgical, or it could be a pathogen or infectious trauma. Here we would see people who have had Lyme disease and they've never been the same. Or they may have had chronic Epstein-Barr, um,
Mm,
and also working with patients that have cancer, which will all by itself disrupt many body functions. But if on top of that, they're taking many medications, that will disrupt many things. We know, for
mm,
example, the liver, because the liver filters medications. So often, someone who's on a lot of meds, another situation is if they're being treated for depression or anxiety, and there are multiple medications, it will affect the liver. So we would say it affects the liver chi. Although their physical organ, the liver, may be fine according to blood tests,
mm,
but they may show signs of stagnant liver energy. And that often would be pain in certain areas or sensations of heat or dryness in the body.
Mm. Wow. Yeah. So, are there any other conditions that you would mention that people often come to you to get some acupuncture treatments for?
Yeah, so there's the range of common conditions. And then there may be conditions that are more unusual, or a person didn't seek acupuncture for that treatment. I would say, in general, in our practices, also with functional medicine, people have gastrointestinal symptoms. It could be chronic, it could be upper reflux, it could be lower constipation, diarrhea, inflammation, and certainly we may do functional testing for that as well.
Mhm.
Um, Cardiac conditions like high blood pressure or poor circulation, hormonal imbalances. So acupuncture is well known. There's specialties of acupuncture that work with infertility problems.
Mm.
So often, if a woman chooses not to go the route of medications, acupuncture has a long history of success. Of course, stress and anxiety will be high on the list. So even if someone came in with a different problem, a GI problem, but they also have a history of anxiety, we may address both simultaneously or focus on one at one treatment and then later on in the week alternate and work on the other issue. And we know they're often connected. People who have GI problems or even high blood pressure, often the underlying imbalance is anxiety. What
Mm.
often goes with that is insomnia or sleep issues, um,
Yep.
busy mind, which may correlate to a particular meridian. The spleen meridian is known emotionally to have overthinking.
Mm.
So if someone came in with anxiety or repetitive negative thoughts, we may use the spleen meridian. Interestingly, the spleen meridian also correlates to digestion. They call it transformation and transportation. You have to transform the food and then get the nutrients to the rest of your body. So again, we would go to the spleen for two completely different conditions. Um, Also neurologic conditions, which often conventionally there's no treatment other than medications to reduce symptoms,
Mm.
which is a good idea if someone's suffering. But I have seen with neurologic conditions that there can be improvement in function. For example, someone who has Parkinson's disease, a reduction in tremor, and increased balance or ability to walk. Um, it's sort of like you name it, and
That's what I'm
acupuncture
thinking.
can
You're
address
just
it.
running through the list, and I'm sitting here wondering why this isn't a mainstay in this country. I have theories about that, of course, as I'm sure many would. But I was reading in some information you gave me how it's recognized by NIH, the National Institute of
Yeah,
Health, and the WHO, the World Health Organization, as being effective. So if conventional Western medicine is on board backing this up, why are more doctors not trained in this modality? Are there serious side effects? Or, are there people that shouldn't be using this? I mean, why it seems to just be so effective for most chronic
that's the
conditions.
perfect question. Why? And
Mm.
some of the theories, the one that pops into my head is often insurance doesn't cover it. So if the
Hmm.
insurance is covering drugs, a person may choose drugs.
Hmm.
Um, And also the lack of education, kind of like what we're doing today. People don't
Yeah.
know. So they think, okay, if I have low back pain, I'll go for acupuncture, but everything else
Mm.
can't be addressed. And I do get that question frequently. Can you treat this with acupuncture?
Yeah.
Interestingly, though, the acupuncture is now being used within the Veterans Administration.
Oh,
So
wow.
it is being recognized by the federal government, and they do employ acupuncturists.
Good.
So with the veterans, we would be looking at definitely a lot of neurological issues, anxiety, depression, pain, injury, post-surgery, um, just about anything.
Yeah.
What I have found with some insurance companies, they will reimburse for low back pain, but not for anything else.
Wow.
So if the patient comes in and they don't have low back pain, they're out of luck. Fortunately, most people do have low back pain, fortunately or unfortunately, because we can address that, but also simultaneously address the other issues.
Mm.
I think another sometimes drawback is, although acupuncture is a complete system of medicine, because we're working on a very subtle level of energy, sometimes the patient needs quite a number of treatments.
Mm.
And in countries with socialized medicine, and they don't have to worry about insurance, they can go for treatments 3 times a week.
Mm.
But if you're paying out of pocket for many people, it's just not very practical.
Mm.
And for me, that's why I'm thankful that I can combine different systems of medicine. So
Yeah.
I can use functional medicine. I can do testing to help me zero in on what's happening on a deeper organic level. I can
Mm.
use Chinese herbs as well. I also have some training in Ayurvedic medicine. I
Mm.
minored in it. So and then looking at the nutrition of the patient and the exercise and the physical therapy,
Right.
perhaps for injury.
Yep.
So when you group these things together, you decrease the amount of acupuncture that's needed, and you decrease the amount of herbs or supplements you use because they are so complementary.
Mm. Yeah, that's what I love, like true integrative medicine where everything is very synergistic and everything works more effectively when combined together. So not having to
Exactly.
overwhelm the patient with so much of one thing. It's just this beautiful symphony of healing treatments that you're
Exactly.
offering to them. Yeah.
Mm.
I love that. So, question, what about people who are like dealing with very complicated chronic complex illness and who are highly sensitive patients? Are those people that could also benefit from this? Do you see people of that nature?
Yeah, yes, probably a lot of patients who come to me like you, they have tried conventional medicine and recognize that after years and years, it's time to try something else. And, they may have had a friend or a family member who benefited and referred them. Um, as our training in functional medicine or naturopathic medicine, even Chinese medicine diagnoses, you're looking at it holistically. So you're not looking at, okay, this person has 20 symptoms,
Mhm.
but looking at what is the underlying imbalance or cause. So the same would apply with Chinese medicine, even though we have hundreds of points to use. A treatment could be 6 points, and
Mm.
it's based upon different theories of what we need to affect. So if I were to look at a very basic foundational level, there's going to be a problem with qi. If people are very ill, they are deficient in qi, they are deficient in that life force.
Mhm.
Um, and the deficiency could be more prominent in one area than another. So it could be more liver, it could be more heart, it could be more gallbladder. Um, So we would, like with anything else, you work with the root cause, and then that affects the branches.
Mhm.
So you wouldn't go crazy following all the branches.
Right.
Um, so it can really address any condition. In terms of people with sensitivities, in many ways, energy medicine is more ideal than
Yeah.
chemical, even if that chemical is an herb or dietary changes. They may be on a limited diet and they can't try too many foods.
Mhm.
But acupuncture is very gentle. And certainly with a patient like that, I would start out very gently, not do a
Mhm.
big treatment, but just gently start pushing the energy and
Mhm.
see how they respond and how they tolerate it. And even my needling technique, which is generally considered very gentle by patients, uh, it would be more gentle with those patients, meaning I would use uh, a finer needle that they may not feel at all, or they hardly feel it,
Mm.
and give them a shorter treatment so you're not overwhelming them.
Yeah. And thank you for bringing up the needle. I've mentioned acupuncture to people and they go, ooh, because they associate needles with pain. So, I've experienced acupuncture and it was painless for me. There are a couple points where a needle would be inserted and I would go, ooh, because clearly there was I would think a blockage there, right? That was being released.
Yes.
I don't know what you would say, but I want people to understand that this is not a painful procedure because it's dealing with needles. So, yeah,
And that's a point that many patients will bring up if they came to me for naturopathic medicine and I mentioned acupuncture. They're like, oh, no, 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 I don't want needles. Sometimes what I do is I take out a needle and I needle myself to show them it's not like a big thing.
right.
Um, the needling is described, or the needles are described that you could fit 10 of them in a hypodermic needle. So it's very,
Wow.
very tiny, like the
Sure.
size of a hair. And of course, they vary in diameter, just like hypodermic needles. And like you said, often the patient doesn't feel it, or they feel just a tiny sensation when it breaks through the skin. Although it's generally painless, I don't tell them it's painless because sometimes you can have a strong chi sensation.
Right.
And that sounds like what you may have experienced,
Yes. Mhm.
where it could be like an explosion, it can feel electric-like, and that's when a
Mhm.
patient says, did you hit a nerve? And interestingly, sometimes that feeling is experienced when you just break through the skin. So
Wow.
you haven't even hit the muscle. You just went through the fascia. So
Wow.
that stuck energy was right on top. It was very surface.
Mm, mm,
And that can be a very strong sensation. Other times it is desirable to get the chi moving so that I feel it and the patient feels it. And if they're okay with it, I may do a little bit more movement of the needle until they feel that, and then we stop.
mm. Yeah.
But people love acupuncture. So even after uh, their condition is resolved, many times just because it's so relaxing and they feel it's balancing, they still want to come in for maintenance treatments without me recommending it.
Mm, yeah. So, for our listeners who are hearing about this for the first time and they're intrigued and they're saying to themselves, I don't know why I haven't done acupuncture. I need to try this. How do they set up an appointment with you? What does that look like? The logistics of it? Can you go over that briefly for them?
Sure. So, like any other appointment for naturopathic medicine or homeopathy, they can contact me um, by telephone, by email. I am listed on healthprofs.com. That
Mhm.
gives a little bit more of a background, and then they can just contact directly, email or a phone call through that.
Mhm.
I do offer a complimentary free phone consult where they can tell me about their condition. I'll let them know how I may address it, what may be involved. Um, and if they feel like this is something for them or they want to try it, then we'll set up an appointment.
Yeah, that's great. And people can go to block134.com, and you are on the practitioner directory and all of your information is there. Yeah, so
Excellent.
that's a
Thank
great
you.
resource for people. I love this. The more I learn about energy medicine and how everything is energy in my own experience as a practitioner and a patient, this is so important for people to learn about, I feel. These do no harm treatments where people can just benefit from it. And let's add, this is an in-person treatment, which I'm finding working virtually with people. There's such a special healing practice just from being with the practitioner and having someone's hands,
Yeah,
working with your body on some level. So I really encourage people to make an appointment with you and to experience it for themselves. I know I will be, and I'm referring a lot of patients to come and see you because I think it can really amplify their self-healing capacity and improve their health outcome tremendously. So I thank you for your work. Pleasure to
thank you.
talk to you. And yes, everybody go to block134.com to learn more about Dr. Irene Catania and to also watch the other videos that we have done, educational videos, and to look for some upcoming in-person workshops and virtual webinars and workshops. So thank you so much.
Thank you. Looking forward to it. Thank
All right,
you.
very good. Thank you.